Hey everyone, and welcome. Today, we're diving deep inside the human body to see some amazing microscopic detective work. We're going to explore the incredible, ingenious techniques doctors use to get the answers they need for a diagnosis, all without ever using a scalpel. So think about this for a second. How do you solve a puzzle that's hidden deep inside someone's body? I mean, how do you get a tiny, super precise sample of tissue when it's tucked away behind solid bone, or worse, nestled right between major blood vessels? Well, the answer isn't brute force. It's this brilliant mix of technology, incredible skill, and just pure ingenuity.
So here's what we're going to cover. First, we'll talk about the mission, why getting these samples is so absolutely vital. Then we'll get into the challenge, which is basically a medical obstacle course inside the body. After that, we'll look at the amazing solutions radiologists have come up with. And finally, we'll see the huge impact all of this has on patients.
All right, let's kick things off with the mission. You see, a biopsy is often the most critical first step in figuring out what's wrong. It's that moment when a little shadow on a scan becomes a real, certain diagnosis. In medicine, they call this the ground truth. It's the hard evidence that guides every single decision from that point on.
Now, the hero of our story today is something called a percutaneous needle biopsy, or PNB. Percutaneous is just a fancy way of saying through the skin. So it's a procedure where they use a really fine needle to get a tissue sample. And the coolest part? They're guided by advanced imaging like a CT scan. It's like having a biological GPS that lets them see exactly where that needle is going in real time.
So why is this such a total game changer? Well, for starters, it's incredibly effective. PNB is super accurate for diagnosing things like cancer. Plus, it's way more cost-effective than a full-blown surgery, which saves everyone a ton of money. It also means you can often go home the very same day, instead of spending days recovering in a hospital. And with the techniques we have now, doctors can safely reach almost any part of the body. It's amazing. Okay, so it sounds pretty straightforward, right? But yeah, it's not always a straight shot. Let's dig into the challenge because some of these targets are hiding in what you can only describe as a medical obstacle course. And this slide really lays it out perfectly. On the left, you see the dream scenario. A nice, clear path straight to the target. Easy peasy. But on the right, that's what we're talking about today. The path is totally blocked by critical stuff, and getting that sample becomes a really complex puzzle that requires some serious creativity. And here are the villains of our story, so to speak. That little biopsy needle has to navigate around solid bone, dodge massive blood vessels like the aorta, and carefully sidestep delicate organs. Heck, even the simple act of a patient breathing can move the target around, which turns the whole thing into an unbelievable test of skill and precision. So, when you're faced with all these obstacles, what do? Well, this brings us to the most exciting part, the solutions. And trust me, this is where medical science starts to look a whole lot like magic. Our first solution is a technique called hydrodissection, and it's every bit as clever as it sounds. The basic idea is, if something vital is in your way, you don't just try to push through it. No, you gently move it aside with a super precise stream of sterile water. Okay, check out this real-world case of a 77-year-old man. You can see the suspicious mass right there on the scan, but look what's sitting directly in front of it. That's the aorta, and the body's other major vessels. Puncturing those is, well, not an option. It's a total no-go zone. So, how do you get there? Here's how it works. It's brilliant. First, a needle is guided right up to the spot just in front of the obstacle. Then, a sterile saline solution, which is basically just salt water, is gently injected. This fluid creates this protective cushion, a temporary little bubble of space that pushes those delicate blood vessels safely out of the way. And just like that, the path is clear, and the biopsy needle can pass right through. And boom, this image shows you the result perfectly. You can actually see the biopsy needle going through that safe tunnel of fluid, getting right to the target without ever coming close to those dangerous vessels. It's just such an elegant, simple, and incredibly effective solution. Okay, but what if you can't move the obstacle? What then? Well, if you can't move it, you've got to go around it. And that's the whole idea behind our second solution, the transmediastinal approach. You can think of it like taking a clever scenic route to avoid a really dangerous roadblock. Now, in this case, the target is in the lung. But here's the problem. The patient has severe emphysema. That means their lung tissue is super fragile. Puncturing it with a needle creates a really high risk of causing the lung to collapse, which is a serious complication. So the direct route through the lung, it's just way too dangerous. So here, the radiologist chose a completely different path. Instead of going in through the side and risking that lung puncture, they thread the needle in through the front of the body, carefully navigating through the central corridor of the chest, an area called the mediastinum. By taking this clever route, they bypass the fragile lung tissue completely and get to the target safely. No lung puncture, no collapse. Just brilliant.
You know, sometimes the challenge isn't just getting to the target, but seeing exactly which part of the target you need to sample. Our third solution is something straight out of sci-fi. It's like giving doctors a superpower by fusing different types of images together.
So, take a look here. On the left, we've got a PET scan. This is awesome at showing a tumor's activity. See those hot yellow spots? That's the most important part to sample. Then on the right, you have an ultrasound, which is perfect for seeing the body's structure in real time. So here's the magic. Doctors digitally fuse these two images, basically overlaying that PET activity map right onto their live ultrasound. Now they can see exactly where that hot spot is and guide the needle right to it. It ensures they get the most valuable tissue for the diagnosis.
All right, our final solution is maybe the most direct of all. If hydrodissection is like creating a path with water, the lever technique is about using a tool to physically and very gently just nudge an obstacle out of the way.
In this scan, you can see exactly what I mean. Loops of the small bowel are blocking the most direct route to the target. So the radiologist uses a special blunt-tipped instrument. It's not designed for cutting, but just for maneuvering. They literally use it as a gentle lever to carefully push those loops of bowel aside, clearing a direct and safe path for the biopsy needle. It's simple mechanics, really, but applied with just incredible precision.
So we've seen all these incredible, clever techniques. Let's zoom out for a second and talk about the big picture. What is the real-world impact of all this ingenuity? What does it actually mean for patients?
Here's the bottom line. This is what smarter, safer medicine looks like. It's all about getting those crucial answers doctors need without having to resort to the risks and the long recovery of major surgery. For the patient, this means a more accurate diagnosis, way fewer complications, a much faster recovery, and in a lot of these cases, it makes a diagnosis possible when it might have been considered way too dangerous to even try before. And that really leads us with a final thought. You know, the future of medicine isn't always about some dramatic new cure you see in the headlines. Sometimes it's about the quiet, brilliant innovations that happen every day in a radiology suite. These clever, safer ways to find the right answers in the first place. Because every single life-saving treatment begins with one thing: an accurate diagnosis. Thanks for watching.